When you combine education, career experience, and passion, that can be truly beneficial to the community that you serve.
So it's a lot of misinformation out there that I wish that we could change that for a lot of my patients.
That's nurse practitioner of Nephrology Associates of Northern Illinois and Indiana, Daniela Baez. I'm Monica Fox, Senior Director of Outreach and Government Relations for the National Kidney Foundation of Illinois, and your host for this episode of The Journey Continues. Today, Daniela will discuss important issues that impact the Black and Brown communities with kidney disease. As a bonus, she'll discuss these issues also with my colleague, Gerardo Huerta, in Spanish. Hi, Daniela. What's your educational and career background prior to coming to Nanny?
Before I came into Nanny, I was a bedside nurse for the kidney floor in Northwest Community Hospital for about 6 years. And prior to that, I actually was part of the community health workers for Northwest Community Hospital, where I had the opportunity to educate Hispanics and other nationalities in the terms of health in general.
And what's your current role at Nanny?
Right now, what I do is I'm a nurse practitioner where I can take care of patients in the hospital, in the acute setting, in the clinic, and also in the dialysis clinics.
Oh, that is fantastic. What a well rounded role. And I can't help but wonder what drew you to renal care.
Kidneys has always been something that I always thought it was very interesting, even when I was really young. Since I was in high school, I always thought that it would be very interesting to learn how to prevent kidney disease or how to help my community to be able to be healthier. I see it in my family, I see it in friends, and unfortunately, the reality is that this illness is not going away. And I wanted to be part of helping my community to be healthier.
That is such an important outlook that you have and such an important role to play in the community because you are right. It really impacts the Black and Brown community more than so much more than others. Speaking of that, in your career, I know that you see a lot of health disparities. Would you please define health disparities for us?
So, health disparities, at least what I've seen in my practice, is that there is a difference between the white community, the Hispanics, and the African Americans. We're at least not able to have the same benefits. One of the major problems that I see is the language barrier. Even though we have interpreter services, it still does not capture the cultural or basically the ability for the community to have access to resources that might be there for them, but if they're not able to obtain it, then I don't feel like it's actually accessible to them.
Yes, that makes so much sense. And also, with regard to health literacy, I'm sure that plays a big part too, in addition to the language barrier. How do you help with health literacy for the patients in your practice that you see?
One of the ways that I help my patients, especially the ones that speak Spanish, is that I reach out to them and I able to give them resources of where they can find the help depending on what their level of education is and depending if they know how to write or read. I do encounter sometimes patients that don't know how to write or read, so I have to help them through the process, which healthcare itself is very challenging. And when you're looking for the help and the resources, even though they're there, it takes a lot of time and a lot of waiting to be able to get the benefits.
And I imagine that having worked as a community health worker really gives you the background to really kind of hone in on these issues.
That is correct. When I was working as a community health worker, I saw closely in my community how, even though we were living in the same area, I saw people or patients that were not able or they were not even aware that there was a community clinic that they can attend to do prevention medicine.
So interesting how things can be right at a person's fingertips and they can't reach it. So we can't help but notice so many dialysis centers being built in Black and Brown communities. Why is this?
I believe that unfortunately, the top two reasons why somebody has chronic kidney disease most of the time is related to high blood pressure, diabetes, which are lead to lifestyle. And I see in my community, in the Latino community, especially the immigrants that come from other countries, that they come in, work, they don't really have health as a priority. And unfortunately, when that happens, then we have the patients that are working a lot of hours. They don't eat properly. They don't drink fluids. They don't even know they have high blood pressure. Hispanics and African Americans are very likely to have these two illnesses, not just because genetics, but lifestyle. Genetics do play a role, but also lifestyle, I would say 50-50. And then, of course, we have the healthcare accessibility that can also play a role. In both of the communities, I see that patients don't seek health care until it's a little bit too late or when they start having symptoms.
So you work in with patients who are on dialysis. What advice do you give your dialysis patients about how to thrive on dialysis?
One of the things that I always tell my patients is to be truthful to me because that's the only way I can help them. I find a lot of times where they're telling me that they're following the diet, that they're not drinking a lot of fluids, but when I ask them to do a recall or a food diary, I find that they are not following the diet or the fluid restriction that they should be on. So I go over that with them a lot. I know that a lot of times they don't have an option of what food they can have, especially if the food that is being offered is the only options that they can eat. And I also feel that I cannot limit my patients to say, well, you shouldn't eat this. But if they don't have access to a different type of food, that's where becomes very challenging.
And another question about dialysis patients, it seems that many people that are on dialysis aren't on the transplant list. Why do you think this is?
A lot of my patients that are not in the transplant list, they're afraid about the side effects of the medications, or they don't have the possibility to travel to the transplant centers. The closest one to our community here is about 30 to 45 minutes if you don't have a transportation, or they just don't feel well enough to go through the process, or they don't speak the language, or a family member had a bad experience. So it's a lot of misinformation out there that I wish that we could change that for a lot of my patients.
So, what do you say to your patients who could be eligible for transplant but aren't interested for maybe one of those reasons that you named or other reasons?
I tell my patients all the time that we have to make educated decisions. If they're interested, if they don't want to have dialysis for the rest of their lives, that they should go to that first meeting, that first call to get more information. I do provide them information, but not in great detail compared to the transplant center. So I always encourage, even if you're curious, you're not going to go to the first appointment and get a kidney. You just have to make that first phone call or that first meeting so you can know more about the process and see if that's something that you would like to do.
You've already discussed issues that are related to social determinants of health. Can you talk a little more about how you're addressing those social determinants of health in your practice?
One of the things that I can offer in my practice is the education, being able to have education access. I always refer to them to reliable sources. I go through them through even teaching them what medication they're taking, what are the medication for. I also share with them the different resources that we have available in the community and ask them to reach out to those resources. Unfortunately, I cannot do it for them because they have to do part of seeking those resources as well.
And are there any resources for patients who are in need of healthier food options? As you mentioned, some people can only eat the food that's provided to them where they live, but are there opportunities for them to obtain healthier food options?
In my community here in the Chicago suburbs, we do have pantries that offer fresh fruits and vegetables. But other than that, I really don't know much more of available resources for patients with kidney disease that can have healthier foods. A lot of the food pantries that I know of also offer a lot of canned foods and box foods, but unfortunately, those are high in sodium. So that wouldn't be a good option for them. But what I do recommend for the patients is to seek those resources or those pantries that do offer fresh fruits and vegetables.
And do you find that insurance coverage is an issue for many of your patients?
Absolutely. A lot of the patients that I have, unfortunately, they start dialysis in the hospital without a health insurance. So, unfortunately, after being diagnosed with kidney disease or at least kidney failure, then you have the possibility of getting insurance coverage through the Kidney Foundation. But that doesn't mean that covers all the aspects of health. And that's one thing that a lot of my patients don't understand. And healthcare insurance, it doesn't become a priority to a lot of my community, unfortunately, because they don't seek health until they're sick.
Yeah, and that's tough to get to start after you're already sick.
And when it comes to healthcare insurance, at least in the area where I live and where I practice, it becomes very expensive. So a lot of my patients is they have mentioned in the past that they cannot afford insurance and afford a healthy diet.
Yeah, that's a common issue in America. People all over are having to make those choices. You mentioned that the American Kidney Fund is one resource that people have when they're on dialysis that will help them with their insurance coverage. Do you know of any other resources available for those with insurance issues?
I know that Cook County, which is the county that is basically in my area where I practice, they do have health clinics available. But once again, it requires for the patient to do the appointment, to wait sometimes 2 to 3 months for that first appointment. Having to provide another challenge is having to provide proof of income. I know a lot of the Latino community in this area, they get pay by cash, so they don't have a proof income. So it's a lot of issues like that that I encounter where they're limited of obtaining healthcare or health insurance, I should say.
So many difficult hurdles to jump through. What resources are patients with early stages of kidney disease given in order to help them slow the progression of the disease?
Even though we all of us know we have to eat healthier, we have to eat vegetables, fruits, drink water, unfortunately we don't do that as much as we should. And when it comes to prevention of the progression of kidney disease, I feel that our resources depend on the patients wanting to seek for that help. I see a lot of patients, unfortunately, when they come to the clinic, they're already in advanced stages of kidney disease and they did not look for healthcare sooner because they didn't have any symptoms. And like I have mentioned, unfortunately, health is not become a priority for a lot of our community because they don't either don't have the health insurance or they don't have a primary doctor or they're afraid to even look for health since they don't want to be known that they're part of the community.
So, what difference do you find that the new medications are making for patients?
A lot of my patients that have kidney disease do have also high blood pressure and they have diabetes. And a lot of the newer drugs we have noticed that delay of progression, which is phenomenal because patients want that magic pill. They want just take one medication that will cure everything. And in reality, I tell my patients there's no such a thing. But now with the newer drugs, I've seen it work and they're more compliant than having to take more than 3 pills every day.
Well, that's hopeful. I'm glad to hear that. What advice would you give to kidney patients that are listening to us today?
One of my advice would be don't wait until the disease has been advanced. When you know that you have high blood pressures, when you know that you have diabetes and they're not well controlled, seek medical attention. Ask your doctor what foods should you be taking, how much water you should be drinking, what medications. Medications are always new medications are coming out every day. So it's important that not just the medical providers stay up to date with that, but the patients also ask their medical providers what are the best options for them.
That sounds like really great advice. Thank you so much, Daniela. I appreciate you for sharing all this important information with me today.
Thank you.
Taking care of your kidneys is important, regardless of what stage of kidney disease you have. If you want more information about kidney care from NANI, go to nephdocs.com. That's NEPHDOCS.com. This episode was sponsored by Nephrology Associates of Northern Illinois and Indiana. I'm Monica Fox, and this is The Journey Continues. Prevention is a key part of our mission at the Kidney Foundation. That's why at the end of each episode, we offer a health tip.
Here's today's nutrition tip about sodium. Our bodies need a small amount of sodium to function, but we typically consume much more than we need. Most of the sodium we consume in our diet is in the form of salt, which is made up of 40% sodium and 60% chloride. The words sodium and salt do not necessarily mean the same thing, but are often used to describe the same concept. For example, on the food label, the word sodium is listed to describe how much sodium is in a food product, while the front of the package may list no salt or low in salt or no added salt. About 70% of the sodium in our diet comes from packaged, highly processed foods and restaurant meals. Too much sodium can increase blood pressure, and high blood pressure over time is a risk factor for heart disease and strokes. It's recommended that adults consume less than 2,300 milligrams a day of sodium, which is equal to 1 teaspoon of salt. Some people may be recommended to consume no more than 1,500 milligrams a day of sodium for some health conditions like high blood pressure or chronic kidney disease. Following a low sodium lifestyle can be made easier by choosing to follow some of the following tips. Check food labels and choose the ones with the lowest amount of sodium per serving. Pick fresh or frozen poultry that has not been injected with the sodium solution. Select condiments with care and choose ones that are reduced or lower in sodium versions. Choose canned vegetables with no added salt and frozen vegetables without salty sauces. If you have to choose a canned vegetable or canned beans with salt, rinse them, drain and rinse them, and you can cut up to 40% of the sodium. Flavor your foods with onion, garlic, herbs, spices, citrus juices, and vinegars in place of salt. Ask at the restaurant if the dish can be made without any additional salt to it. And always taste your food before adding any salt. With today's nutrition tip, I'm Melissa Prest, a registered dietitian nutritionist